everyone! So, long time no video, so hopefully this one will be a good one. I'm going to cover schizophrenia and just kind of give a good overview on schizophrenia since I haven't really made a video covering that yet. I've done schizoaffective, but not just plain schizophrenia. So I do have notes that I'm going to read off of just because I'm not good at reading and then remembering and so forth. So we're just going to go off of my notes here. But basically, so schizophrenia, people with the disorder may hear voices other people don't hear. They may believe other people are reading their minds, controlling their thoughts, or plotting to harm them. This can terrify people with the illness and make them withdrawn or extremely agitated. People with schizophrenia may not make sense when they talk. They may sit for hours without moving or seem perfectly fine until they talk about what they are really thinking. Many people with schizophrenia have difficulty holding a job or caring for themselves, so they rely on others for help. However, many people with schizophrenia can lead rewarding and meaningful lives in their communities. And there are TED Talks out there on, a woman, I can't remember her name offhand, but she has a TED Talk and she has schizophrenia. And I believe she's a university instructor and possibly, maybe a lawyer. I'm not sure. I could be totally wrong. But she is phenomenal with maintaining her illness and still leading a successful life. So there is hope. Now, as far as causes, scientists have long known that schizophrenia runs in families. The illness occurs in 1% of the general population, but it occurs in 10% of people who have a first-degree relative with the disorder, such as a parent, brother, or sister. Scientists believe several genes are associated with an increased risk of schizophrenia, but that no gene causes the disease by itself. Recent research has found that people with schizophrenia tend to have higher rates of rare genetic mutations. These genetic differences involve hundreds of different genes and probably disrupt the brain development. Other recent studies suggest that schizophrenia may result in part when a certain gene that is key to making important brain chemicals malfunctions. This problem may affect the part of the brain involved in developing higher functioning skills. In addition, it probably takes more than genes to cause the disorder. Scientists think that interactions between genes and the environment are necessary for schizophrenia to develop. Many environmental factors may be involved, such as exposure to viruses or malnutrition before birth, problems during birth, and other not yet known psychosocial factors. Scientists think that an imbalance in the complex interrelated chemical reactions of the brain involving the neurotransmitters dopamine and glutamate and possibly others play a role in schizophrenia. Brains of people with schizophrenia look different than those of healthy people. For example, fluid-filled cavities at the center of the brain called ventricles are larger in some people with schizophrenia. The brains of people with the illness also tend to have less gray matter, and some areas of the brain may have less or more activity. Scientists found small changes in the distribution or characteristics of brain cells that likely occurred before birth. Some experts think that problems during brain development before birth may lead to faulty connections. The problem may not show up in a person until puberty. The brain undergoes major changes during puberty, and these changes could trigger psychotic symptoms. So, a lot of times in puberty is when you'll first experience a psychotic symptom. So, who is at risk? About 1% of Americans have this illness. Schizophrenia affects men and women equally. Symptoms such as hallucinations and delusions usually start between ages 16 and 30. Schizophrenia rarely occurs in children, but awareness of childhood onset schizophrenia is increasing. Now, for the signs and the symptoms of schizophrenia fall into three broad categories. positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms are psychotic behaviors not seen in healthy people. People with positive symptoms often lose touch with reality. These symptoms can come and go. Sometimes they are severe and at other times hardly noticeable. Hallucinations are things a person sees, hears, smells, or feels that no one else can see, hear, smell, or feel. Voices are the most common type of hallucinations in schizophrenia. The voices may talk to the person about his or her behavior, order the person to do things, or warn the person of danger. People with schizophrenia may hear voices for a long time before family and friends notice a problem, and that's definitely the case for me. No one noticed that I was hearing anything. Other types of hallucinations include seeing people or objects that are not there, smelling odors that no one else detects, and feeling things like invisible fingers touching their bodies when no one is near. Delusions are false beliefs that are not part of a person's culture and do not change. People with schizophrenia can have delusions that seem bizarre, such as believing that the neighbors can control their behavior with magnetic waves. Sometimes they believe they are someone else, such as a famous historical figure. They may have paranoid delusions and believe that others are trying to harm them, such as by cheating, harassing, poisoning, spying on, or plotting against them or the people they care about. Thought disorders are unusual or dysfunctional ways of thinking. One form of thought disorder is called disorganized thinking. This is when a person has trouble organizing his or her thoughts or connecting them logically. They may talk in a garbled way that is hard to understand. Another form is called thought blocking. This is when a person stops speaking abruptly in the middle of a thought. Movement disorders may appear as agitated body movements. A person with a movement disorder may repeat certain motions over and over. In the other extreme, a person may become catatonic. Catatonia is a state in which a person does not move and does not respond to others. Now moving on to the negative symptoms. Negative symptoms are associated with disruptions to normal emotions and behaviors. Flat affect, a person's face does not move or he or she talks in a dull or monotonous voice. Lack of pleasure in everyday life, lack of ability to begin and sustain planned activities, speaking little even when forced to interact. And I do definitely relate to all of those. So negative symptoms are a lot harder to treat than positive symptoms. People with negative symptoms need help with everyday tasks. They often neglect basic personal hygiene. This may make them seem lazy or unwilling to help themselves, but the problems are symptoms caused by the schizophrenia. Moving on to cognitive symptoms. Cognitive symptoms are subtle. Often they are detected only when other tests are performed. Examples are poor executive functioning, the ability to understand information and use it to make decisions, trouble focusing or paying attention, problems with working memory, the ability to use information immediately after learning it. Again, more things I can certainly relate to. As far as treatments go for schizophrenia, antipsychotics, basically, Seroquel, Latuda, Geodon, Risperdal, and Vega, and so on and so forth. I mean, there's a lot of them out there that you can try. So there is a lot of antipsychotic treatments out there as far as medication goes. Of course, you also have psychotherapy, self-help groups, hospitalization, partial hospitalization. So there is a lot of support out there that you can get. Now, as far as schizophrenia and violence, this is a big misconception that people have. But what's true is actually that people with schizophrenia are usually not violent. In fact, most violent crimes are not committed by people with schizophrenia. However, some symptoms are associated with violence, such as delusions of persecution. Substance abuse may also increase the chance a person will become violent. If a person with schizophrenia becomes violent, the violence usually directed at family members and tends to take place at home. the risk of violence among people with schizophrenia is small. Now, as far as suicide, about 10% of patients with schizophrenia die by suicide. Now, what about substance abuse? Some people who abuse drugs show symptoms similar to those of schizophrenia. Therefore, people with schizophrenia may be mistaken for people who are affected by drugs. Most researchers do not believe that substance abuse causes schizophrenia. However, people who have schizophrenia are much more likely to have a substance or alcohol abuse problem than the general population. Substance abuse can make a treatment for schizophrenia less effective. Schizophrenia and smoking. Addiction to nicotine is the most common form of substance abuse in people with schizophrenia. They are addicted to nicotine at 3 times the rate of the general population. Smoking may make antipsychotic drugs less effective. Quitting smoking may be very difficult for people with schizophrenia because nicotine withdrawal may cause their psychotic symptoms to get worse for a while. So that's basically what I have as far as an overview of schizophrenia, and I hope that helped to give you all some good information. And thank you all so much for watching, and I will see you in my next video. Please subscribe if you have not already. And again, thank you so much. Bye guys, I love you.